Welcome to this information session on the Creative Health Leads in Systems programme. As I say, people will continue to arrive, but they'll be able to pick this up. We are recording the session. So if you do miss the beginning, you can go back and have a quick look at that, anybody. So I'm Jane Howard and I'm Head of Programmes here at the National Centre for Creative Health, and I'm joined today by our General Manager, Alexis, who's set up the session today and will be supporting me with the tech and with gathering the questions as we go through the session. We're in webinar mode, which means that you'll be muted during the session. And as I said, we are recording the session. Now, although the majority of the session will be a presentation, do be aware that there will be those little boxes visible down the side of the screen. So if you really don't want to be seen, turn your camera off. Your initials, I think, will still be visible, although I can't see any initials on anyone on mine. But I think... yes, I think that's it in terms of tech. I think Alexis has put some things in the chat, put the agenda in the chat, and any support that you need. So if you're having any difficulty, please use the chat to, and Alexis will be monitoring that as we go through. So I'm going to run through a presentation which will give you an overview of the programme and what we're looking for, and details of the application process, and there will be time for some questions. Please put your questions in the Q&A or the chat if you find the Q&A difficult as we go along too. And then Alexis will gather those questions at the end and we'll respond to as many as we can. If we don't have time to answer all of the questions today, we will follow up and we'll be posting all responses on the programme's webpage so that others can see them as well. So if we don't get to your question today, for whatever reason, either we don't have time or we need a bit of time to think about it, we will follow up with that. Just a reminder that this is a programme that is aimed at health and care systems. So for an individual looking for a creative health lead role, this might be of interest to you, but it's not going to tell you about how you apply for one of these roles. That will be down to the individual successful systems going through their recruitment processes. So just in case any of you have come along thinking that's what you're wanting to hear about, that isn't what it's going to be. It's going to be about how the systems can apply for this programme. So very briefly, just in case we have people on here who aren't familiar with the National Centre for Creative Health, the NCCH, and our work, I'll begin with a bit of background. NCCH was formally launched in March 2021 with a mission to advance good practice and research, to inform policy and promote collaboration, and helping to foster the conditions for creative health to be integral to health and care and wider systems. So this programme is clearly an important aspect of that mission, about embedding creative health within health and care systems. We define creative health as creative approaches and activities which have benefits for our health and well-being. And these activities can include the things that you might expect to think of when you think about arts and creativity. So it might be about visual and performing arts, crafts, film, literature. But it also includes, from our purposes, it includes things like cooking and creative activities in nature, such as gardening. And creative health approaches may involve creative and innovative ways to approach health and care services, things like co-production, education and workforce development, centering lived experience. And creative health is something we see being applied in homes, in communities, in cultural institutions and heritage sites, and in healthcare settings. So it's a very broad sort of umbrella term, really, for a lot of activity. And some people may be involved in just some elements of that activity, and others, across the whole spectrum. But it is about intentionality, I think, is the first thing to say. So we know that engaging in creative and cultural pursuits is good for our health and well-being anyway. There's a certain degree of intentionality in the work when we describe it as creative health. There is something about, there's very specific intention to have that benefit. And creative health can contribute to the prevention of ill health, the promotion of healthy behaviours, the management of long-term complex conditions, and treatment and recovery across the life course. So we do have that very broad view of creative health. So that's just a little bit of background for any of you who don't know about us and our definition of that work. So this programme, the Creative Health Leads in Systems programme, was launched in December last year. And the purpose of this programme is to integrate and embed creative health into key NHS and broader health priorities. So it's about public and population health. It's about looking at opportunities for creative health as part of clinical and care pathways. And it's about how creative health integrates into the development of a neighbourhood health service. And we're certainly seeing that becoming much more, that seems to be an increasing focus for this work. And we see creative health playing a role in the three key shifts in the 10-year plan for the NHS: treatment to prevention, hospital to community, and analogue to digital, as well as contributing to system change and transformation that's needed as part of the NHS Fit for the Future. What we want to see through this programme and through, you know, as it becomes embedded, what we're wanting this to lead to is an increase in creative health activity in health and care systems, and thinking about that spectrum of creative health activities. And what that leads to is health and care systems which are more person and community centred, and ultimately less pressure on the health system. So that's really the purpose of the programme. Just some key points about the programme. It is being funded by Arts Council England and the Bearing Foundation over 4 financial years. And it builds on the learning from our Creative Health Associates programme, which ran from July 2023 to March 2025. And in that programme, we had 7 Creative Health Associates, 1 in each NHS England region. And they were hosted by ICB's integrated care boards in those regions. And what that programme did was it identified where the opportunities might exist to embed and integrate creative health most effectively. It also catalysed new networks and partnerships between the health and care and the creative and cultural sectors. And it demonstrated the potential of such roles to contribute to wider system transformation. So it's building on that programme and taking the learning from that programme into this programme has been really important. It's a rolling programme of applications. We've already had 2 application rounds, resulting in 12 systems being successful. And we're expecting to hold another 3 rounds, one with a closing date in September this year, and I'll come back to that timetable a bit later. And then with 2 further rounds of applications next year. That's our expectation at the moment. As I said, it is a health and care system facing programme with a real focus on supporting the 10-year plan for the NHS in England, and with an underpinning theme of reducing health inequalities. So that's a really important feature of the programme. What the programme offers, the funding that we've got from Arts Council England and the Bearing Foundation, what it offers, and sorry, just to say, it is a programme for England, because it is funded by, part funded by Arts Council England, so it is England only. But it offers a salary subsidy for a creative health lead role, and I'll give some more detail on what that role looks like in a moment. And we anticipate about 30 posts across England over the next 3 years, with the final round of posts being agreed probably this time next year. Alongside that salary subsidy, there'll be a structured development programme for the creative health leads, and we'll be looking to also develop a programme for others who are working in the system, who are supporting those leads, either managing them or they're in those teams, because we want to share this learning across systems and not have it held within one individual or even one organisation. A key difference from this programme to that of the Creative Health Associates programme is that these roles will be employed within health and care systems, so health and care organisations. Last time, the Associates programme, we employed the associates and they were hosted by ICBs. In this programme, we are expecting them to be employed by health and care organisations. And again, I'll say more about that in a bit and the various options for that, how that might work. And with 12 systems already been successful, we've got some examples of employment employers within the programme. So I guess we'll first take a look at the money. So the programme provides a salary subsidy of approximately 50% for the first year of the post and 30% for the second year. So we're looking at a minimum of a 2-year post. And this is based on the roles being 4 days a week. And we did that because we find increasingly people are looking for roles that give them a little bit more flexibility. And the salary is at the entry point level of an NHS Band 7 or the equivalent in a different organisation. So that's about 48,000 pro rata on current pay scales. And the subsidy includes, includes on costs. We've also factored in a 3% cost of living increase in each year, and we'll see whether that is sufficient or whether we need to be budgeting for more than that. We'll know more than that. We'll know more about that next year. So in the first year, we provide roughly £25,000, and in the second year, roughly £15,000. So we're providing total support of in the region of £40,000 over 24 months. And there's a requirement, therefore, for match funding from the health and care system, which is 25,000 for the 12 months, 35,000 for the second 12 months, so a total of 60,000 roughly over 2 years. So it's a 60-40 split, with 60% of the funding being provided by the organisation or the partnership and 40% being provided by us through this programme. In reality, the amounts we've committed to date have been a little over that £40,000 mark, taking account of on costs, etc. So if you're putting an application, please make sure that you show the total costs of the role that you're looking to appoint to, the banding level, including the on costs and any potential pay increases, and demonstrate your match funding against that total cost. So don't just go in and go, it's 25 and 35, because it actually is slightly more than that, given that we've already had one pay increase this year. And we're not wedded to particular financial years for our purposes. So it'll be for organisations to work out how best to manage that. It can run over more than 2 financial years as far as we're concerned. So have a think. If you're looking at this, just think about what does that mean for your financial years, and if you think there's any adjustments needed in terms of the way that split of funding happens, just come and talk to us. There does need to be a commitment to a 2-year post. That's a requirement. The other really important issue here is that match funding cannot be from arts or culture budgets. The funding that is being provided from Arts Council England and Bearing Foundation is arts and culture money, and it is aimed at leveraging in funding from the health and care sector. Now, on top of the match funding for the salary, if there is additional budget being provided for, delivery budget or for additional hours or whatever, that could come from budgets that are outside health and care. But that match funding has to come from health and care sector. But match funding can come from a number of sources, a number of partners, and we've already seen match funding being provided by 4, 5, 6 organisations within a partnership: local authority, public health, NHS trusts, ICBs, etc. And that's what we're anticipating. That obviously means that the burden of funding is shared, makes it a lot easier to potentially find that funding. And it also demonstrates a sort of commitment from a number of partners to the programme. But obviously, if one organisation is able and willing to fund the entire match, that's fine too. And we have got examples of that. I'm just going to say a little bit about the development programme for the Creative Health Lead post holders. The purpose of this development programme is, as it says, to provide a space for creative health leads to exchange knowledge, discuss challenges and opportunities, and build their leadership skills. Now, whilst we expect the creative health leads to be integrated into their local teams, we also know that these may be roles that are quite different to many others in their organisations, and they may be working in contexts where they could feel quite isolated or alone in terms of what they're trying to achieve. So we think it's really important that they have that opportunity for that programme, for that development programme, for their own support, as well as an opportunity to share their learning with others. We want to co-design the programme with the creative health leads, but it feels appropriate to have a sort of initial outline as they take up these new roles, so that we've got something on the table to offer. And the programme is being designed with sufficient flexibility to respond to the programme as it evolves. So we'll have people joining the programme at different times throughout its lifespan. So we will be bringing people in at different times. We may, if we end up with, we have 30 creative health leads, we may develop some regional learning networks, we may develop some thematic networks as well for the larger group. So we're open to how that evolves, but we're beginning with an idea about how this will work. We're expecting that the creative health leads will come with a wide range of different experiences and skills and knowledge. So we are anticipating that peer-to-peer learning will be a really important element of the programme. What we're suggesting at this stage is that the initial 4-week period, there'll be some intensive learning sessions which will get everybody on the same page, basically, in terms of this programme. So that will be exploring the purpose of the programme, understanding the health and social care landscape, understanding the creative health landscape, recognising that people may have come from one or the other sector. So there'll be a lot of sharing we anticipate going on there. We'll be exploring equity, diversity and inclusion within the context of creative health. An update on evidence and research, and an understanding of health inequalities and population health. And we'd repeat those intensive learning sessions over the lifetime of the programme as more roles are established. So we might expect to have, 3 4-week blocks in the first year of the programme, potentially. And then we're looking at having 6 weekly online peer support and learning sessions, which will include topics such as systems thinking, using health and other data, mechanisms for health and social care integration and collaboration, commissioning and funding models, impact measurement, evidence and research updates, skills and knowledge exchange, looking at using the creative health quality framework, a whole range of topics there. And we're open again to whatever it is that creative health leads identify as what they need. So those will be 6 weekly sessions. As I say, we're expecting the creative health leads to be part of those. And then in between those sessions, we're having some optional online drop-in support and development sessions, which will be facilitated by me and applying principles from action learning and human learning systems. It won't be an action learning set, but we will be using those principles of peer coaching and human learning systems thinking to run those sessions. We at NCCH are part of a wider creative health ecosystem, and we anticipate close working with our partners in the Culture, Health and Wellbeing Alliance, London Arts and Health, and the GLA, the Metro Mayor's Creative Health Network, and the National Arts in Hospitals Network, so that this sort of community of practice is inclusive and benefits from the collective knowledge, perspective, and expertise of the wider sector. So we are looking to integrate as much as possible, so that we're not sitting here with completely separate programs, but we're sharing the learning more widely. Excuse me. And as I said, we'll also be working with the wider system, so not just with the creative health leads, but others who are working with them. So this could be their line managers or other team members. We're trying to keep that quite open. And that's a sort of development program to help them embed creative health in the system. We held an initial meeting of system representatives from the first 12 systems a couple of weeks ago, and there was real enthusiasm for a network whereby people could meet up, discuss progress and challenges, and share resources and ideas, and discussion about a Teams forum, which we're working with colleagues in the NHS to set up. So just at that meeting where we had every single system represented by at least one person, there was a huge range of sharing and of connectivity that people seem really excited about. So we'll be working up that network. Bearing in mind people are really busy, so we want this to be helpful to people and not something that they feel, oh, we've got to come along to this and it's not really very useful. So we're trying to keep it open, fluid and responsive. We're also anticipating that there may be workshops on particular topics. We might have some opportunities to test out tools and approaches, and sharing learning about models of effective working. So again, we'll be putting an initial programme together, but we will be responding to the needs of the people in that network. So just thinking about these roles then, we expect these roles to be bespoke to each system, responding to local context and local priorities. We have drafted a core job description, which can be adapted accordingly. It's in the information pack that you can download from the website. But we're very happy for that to be adapted. That's a sort of starting point, really. We're also, as I suggested earlier, we're not being prescriptive about where posts are based in terms of their employment. Now, when we first began discussing this programme, we were talking about them being in integrated care boards, in ICBs, but that was pre the sort of restructuring of the NHS. And given there's that changing, that restructure of ICBs, some ICBs now are likely to be, they either are or are likely to be really big. One role is not going to go very far in an ICB. We've also had the development of the neighbourhood health service model, and the future role for ICB is still to be fully defined, we think. So we've gone for a much more flexible approach. So the role could be in an ICB, but it could also be in an NHS provider organisation. And we're hearing about things like advanced foundation trusts and integrated health organisations, where those providers are taking on, wider responsibilities. And the development of the neighbourhood NHS, as I've said, provides further opportunities, and we're seeing a lot of interest in that from applicants so far. And the role might also sit in local authority public health teams. And there may be other organisations that have formal partnership arrangements with the NHS. Really important thing to note, however, is that we don't expect these roles to sit within creative or cultural organisations or teams. They do need to be sitting within the health and care system. And in terms of recruiting to the role, so we've had a lot of interest as people seeing the programme and, can I apply for one of these roles? We're not doing that recruitment. That will be for the employing organisation or partnership to determine how they do that. We're not going to specify that process, but but we will be involved in that process. But we're asking them to come up with whatever's appropriate for them. And they, of course, when there's restructurings going on, etc., there may be challenges within that. Since we've now had 12 successful systems, I thought it'd be useful to share with you some of the characteristics of those successful applications, so you can sort of see the types of things that are being supported. Firstly, this is just a list of the 12 systems with there's a sort of rough geographical points on the map, those the blue and red little markers on the map showing where they are. Obviously, they encompass a wider geography than just that point. And we are aiming over the programme to get a good geographical spread across England. At the moment, if you look at that map, you can see we have big gaps in the east and the northeast and across the Midlands. Now, we do know that we are expecting some applications coming in from those areas in this third round. But after this third round, we may want to take a view on more focused geographical targeting next year, so that we can support some of the systems in those areas where we've got big gaps to have one of these roles. But you can see that's the list of successful applicants to date, and they are quite wide ranging in terms of their size and scale, and a mix of sort of urban and rural within that. And I just thought I'd share with you what we've seen in terms of the sort of partnership models, employers, areas of focus, etc. So the partnership models that we've seen come forward, I would say public health has a strong presence in all of the partnership models that we've seen. And we've also seen NHS trusts joining as partners, which wasn't necessarily something we'd anticipated in the beginning. But especially in those areas where an NHS trust is leading on the implementation or development of the neighbourhood health service, which is happening in a number of places. We've also seen a couple of applications with a strong primary care focus, and also a couple with university input, and the university is bringing sort of added value in the form of either local evaluation or opportunities to benefit from other research links. It's important, these roles, we're not expecting to see them employed by universities, and university funding will not count as match funding for the salary, but those links with universities can provide that added value. And in terms of employment, as we knew, it might be difficult for ICBs to employ these roles in this restructuring and the reduction in headcount that's required. But it is happening in some places. In others, the posts are going to be within public health teams or in NHS trusts, but working on behalf of a wider partnership. And we've also got a couple where there are joint posts jointly appointed between public health and a provider, for example. Now, we have been asked about post holders being employed by the voluntary community faith and social enterprise sector, the VCFSE organisations. And while it's not an absolute no, we will be giving priority to applications where there is an employment commitment from the NHS or public health, as we think that provides a more demonstrable level of support than just providing funding. Now, we have been challenged on this, and we do understand that, the intention is for the VCFSE sector to sit around the table as an equal partner with the public sector, and we absolutely support that. But I think at this stage, we still feel there's more of a risk of posts being sidelined or forgotten about if priorities change, if they're not within the public sector organisation. Happy to have conversations with individual systems about that, but that has been our experience so far. We've funded all the systems we've funded. They've got posts where they're employed within the public sector. We've also seen sort of different emphases on what the priorities are for these posts. The overwhelming majority, however, are focusing on integration with neighbourhood health developments. And I think we can see that that's, very clearly the sort of way in which the NHS is moving. I was at the NHS Confederation Expo last week, and every other Every other panel discussion workshop was about neighbourhood development. Consistency in terms of direction of travel. I think nobody was saying, no, this is the wrong thing to do. It's still a lot to work out in terms of what that looks like. But clearly, people seeing the development of the neighbourhood health service as really key. So it's unsurprising that we see these posts having that at their focus. But we've also had applications with a focus on particular groups or conditions, and a couple which have talked about embedding creative health in a broad health and wellbeing strategy or as part of commissioning plans, for example. So again, there is scope there for applications for, from a range of different partnership models with different employers and different emphases. However, I think it's also worth saying that given that we're aiming for these roles to have impact across a system, we're probably not looking at supporting roles that have a very small geographical footprint. For example, a single primary care network that might be quite small, or are just focused in just one organisation and the work of just one organisation, or they've got a very, very tightly defined focus, which has limited a sort of applicability across the wider system. So whilst we're not saying this has to be across, it doesn't have to address everything, it doesn't have to be across a whole ICB footprint. There can be some focus in there, but just think about where are the opportunities to scale and spread the work from this programme. Remember, you can talk to us anytime about your ideas. We'll help you think that through. If you've got some, if you want to talk to us, we're absolutely open to that. We would encourage you to do so. I think it's definitely the case that where we've had applications in where people haven't spoken to us at all beforehand, and there are some things that we could have really helped with if we'd known that they were thinking of applying. We know that this is a competitive process. When we started out, we weren't sure how competitive, but we had 27 applications across the first 2 rounds, and we funded 12. So we've had to very strictly apply specific criteria at both the shortlisting and interview stage. And so here are the criteria by which we're assessing applications. So the more of these that you can match, the higher application will score. And that's particularly important, I would say, at shortlisting stage, where we're looking at this in some detail. So priority will be given to systems that can demonstrate the match funding from NHS or public health budgets. That's a requirement. That there is NHS or public health employment of the post holder. Again, I've mentioned that previously. That if they're not employed by an NHS organisation, that there is an NHS hosting and management arrangement for the post holder. If there's a delivery budget over and above the match funding, a delivery budget for creative health activity, or if there is additional funding to maybe make the post a full-time post or extend it beyond 2 years, that will score more highly. We want to see a focus on health inequalities and areas of deprivation, and we'd like that to be really clear rather than just a blanket statement, just something around how you see this post addressing the particular inequalities in your health and care geography. We're looking at opportunities to integrate with social care. We've had only a couple of applications, I would say, where social care have been named as a partner, but having social care part of this is quite important to us. And also where there's an infrastructure or to support the role, a partnership group or board or committee. Now, it might be that some of that is about it needs to be formed in order to support this, but just some thinking around that, because as we said, these roles, they could be quite isolated. They do need that support around them, and they need to be able to access different parts of the system. So how will the infrastructure help that? And then any added value that is brought to this, as I've mentioned, universities and various sort of researchers and other things that might come in that add value to the application. It's I think we should stress that we want to support roles both in areas where work is not very well developed, as well as in those where there's a lot of existing work but scope for further development. So it's not going to be about just those systems that are really well advanced with their creative health work. It provides an opportunity to support new ways of working in systems that are just beginning. And in that 12, the first 12 that we've got, we have got that mix in there. We've got systems that are pretty well advanced, but we're able to make a very clear case for why this additional support would really help them to take a further step forward. And we've got others that have said, you know, we're just starting on this journey, but we have commitment, and we have clarity about what we want to try and achieve. So it's not always about those that are, say, well advanced. As I say, the commitments that are required: match funding for the post for 2 years, absolutely essential. And match funding, as I've said before, cannot be provided from arts and culture budgets. Make sure if you're putting in your application that your match funding is sufficient. You know, it does cover 50% in year one and 65% in year two, sorry, including the on costs, etc. Don't just put in a rough figure. We need to see that. That helps us to feel confident that there's been some real thought given to what you know, where this post, what the salary scale is for this post if it's not in the NHS, and real thought given to how it will you know, how it will be supported in the system. The posts need to be on an employment, not a freelance contract, but it could be a secondment. So we are open to that. If the person is not employed by the NHS, I think the most important thing here is that they have an NHS email. We know that that is really critical in terms of opening doors in certain places. So that's something we ask for in the application. Applications must be supported by multiple partner organisations, not just the employing or funding body. We're really wanting to get this cross-sector buy-in and sustainability from across the system. Now, we're not saying that all partners in a system have to be committed to this. We know that might be quite difficult, but it needs to be broader than just one organisation. And then there'll be that when you need to demonstrate there'll be support for the post holder to participate in the learning programme that I mentioned earlier, and others will be willing to engage in that system development programme. So we're asking for that commitment at the application stage. So who can and can't apply? Health and care organisations on behalf of a partnership. The programme is for health and care systems, and as such we would expect to see a health or care organisation as the lead applicant. It could be that the lead applicant isn't NHS or local authority. It could be a different type of partner, but there must be a public sector health and care partner as part of the application. And remember, for NHS or public health employment and funding, will score higher when we come to assessment. It's not open to individuals to apply. As I've said, those roles will come on stream once the systems have been successful. They will go down a recruitment process, and we've got, you know, recruitment underway at the moment in some of those first 12 systems. And it's also not open to creative and cultural organisations to apply, although of course they can be partners in the application if that is appropriate. So we're nearly there. What to do if you're interested? Well, please do talk to us at NCCH. Ask us any questions as well. There may be things that we haven't thought of. There certainly were in the first couple of rounds. So we're really open to that. And it's not just a one-off discussion. You know, if you need to come back, then please do. And then complete the application form, which you can get from our website. We've tried to keep it simple. We've had some feedback that said, yes, it was simple. Thank you very much. So it's just space for you to tell us how you would use the role. Again, if there are any questions in there that you need clarification on, do get back to us. And if you are thinking of applying, you know, have a good look at the application well in advance of the deadline, because if you have got questions, we don't want to be trying to answer those at the last minute. We have a deadline of the 18th of September for this next round of applications. The process is that we shortlist from those applications, and then we hold online interviews for the shortlisted applicants. And we've already set the date for that of the 14th of October, and decisions being communicated by the end of the following week. It's just worth saying that up to 2 people from each system are invited to attend for interview. So again, if you're putting in an application, worth thinking about who those might be, and getting that date in the diary. We're then expecting to announce the dates of a further 2 application rounds, probably in March and June next year. If you don't think you're ready to apply for September, but you may be considering applying next year, it's also worth getting in touch with us now to let us know. It helps with our planning and our communications to know what might be in the pipeline, and also to sort of assess the potential geographical spread of applications. So if you're thinking, yeah, but not just yet, but we probably will be ready for March next year, or even June next year, do start to at least speak to us now, just so you don't have to give us any detail around that, but just so we can log that interest and get a sense of what might be coming down the line. So if you want to get in touch, do contact me via email. These slides will go out to you after this event. So yeah, do contact me via email and we can set up an online meeting. That's it from me. We've got about 15 minutes for questions. It was a lot to get through. I'm very happy to try and respond to any questions, so that Alexis has been gathering if there have been any. And we will be putting the responses to questions up on our webpage, and a recording of this event as well, if you need to send that to anybody else. So yeah, I'll finish and stop sharing there, and ask Alexis, do we have any questions?
Yeah, so we have one question in Q&A, Jane, and a couple in to chat. So Mike asks, could the host organisation be a health and social care charity, which is currently formally commissioned by both the ICB and public health team?
So again, I think it's not an absolute no. I think we need to understand where it sits in the system, so and what it's commissioned to do and how integrated it is in that system. So it's not a no. But the funding, the match funding, would need to be very clearly identified as ICB and or public health money that was providing the funding for the match funding for that salary. And it may be, so one of the things that I know one of the applicants put in, they were considering this role being employed in the VCSC. What they came up with was a role being employed I think it was in a provider trust in the end, but with a matrix management around it, which included that charity. So that's another option to think about. How do we make sure that these roles? It's really about how central they can be to the health and care system. So it's not a no, but we probably worth having a conversation with us about where that charity sits in the wider system and what the opportunities are to influence across the wider system.
Great, thanks, Jane. We had one question from Carolina saying, don't remember from the map, but does this project extend to Scotland?
No, sadly, it doesn't. It's funded by Arts Council England, so it is England only. That's the second query we've had from people in Scotland. So maybe we talk to Arts Council in Scotland, but yeah, no, it is just England only.
Great, thanks, Jane. And then Morag asked, are we able to see the detail of current successful applicants and their plans for the future? So obviously their applications which have been successful and what they are thinking of doing. I'm guessing, Morag, maybe that's for examples, but also for maybe those people who want to focus in on those current applications for roles, I guess, upcoming.
Yeah, so 2 things. So firstly, on the website, we do have information, a brief information, a couple of paragraphs about each system and what they're focusing on. I can't share with you all the detail of their application, clearly, because that is an application that is was sent to us as part of this process, and we're not able to share all that detail. I can speak to them about sharing their contact details so that people could get in touch and ask them questions. People were very happy in the meeting with the 12 systems the other week to share amongst themselves. So I think it's probably just a capacity issue for people, but yeah, and you can always contact me if you have a look at what's up there and you think, oh, that sounds interesting, that sounds like something we're doing, we're thinking about doing, you can always have a chat with me and I can tell you a little bit more about that. I can't share the full applications with you, but we will be, as the programme develops, we will be highlighting the sort of progress and events and challenges on the website for other people to learn from too.
Right, thank you, Jane. Let me just check the chat. We had Morag said sharing contact info would be great. I'm interested in SWL ICB. And then we had another one, but I think Anishka, maybe we'll email you separately, Jane, but it does just say, does the match funding have to be from the NHS or public health budgets? So I did ask about giving an example where they're thinking of maybe that match funding might be coming from. And they said that they would get in touch with you directly. But yeah, as you stated, it kind of has to be. So
yeah, it does really. It's got to be leveraging in money from the health and care sector. Yeah.
Okay, and then Carolina has just asked in kind of response to the geographical funding. She said, you mentioned a focus on geographical funding, but would you consider a funding thematic cross-regional project instead? For example, a national network for palliative care, social workers looking to incorporate creative arts into their practice.
Definitely consider it. It's not something we've particularly thought about, and we've not had any applications of that type. So that would be very interesting to look at, to have a conversation about that and what that would mean. Yeah.
Right. Currently, I don't think there's any more questions. Let me just, Caroline said, great, thanks for that, Jane. She'll be in touch. Has anyone got any further questions they'd like to put in the chat? No one's, or in the Q&A. So I hope, Mike, that answered your question in the Q&A, and obviously feel free to contact Jane around that, the social care charity. I don't think any more is coming in, Jane.
No, okay. Well, if there are questions that you have after this event, you can always drop me an email. As I say, very open to having conversations as well. We want to help. We want to help systems get the best applications that they can in. We want to have these roles across England. We're wanting to help you to do that. So please do talk to us if you've got ideas and thoughts about what about putting something together, and we'll try and help you through that process. Great.
And I've just put for everyone, we will send a post-event email with Jane's slides, obviously any questions, an update on the FAQs. And also I've just put in the chat here more information about the Creative Health Leads programme and how to apply. So on that page, there's all the dates and the application forms and more information. So please feel free to have a look at that page as well. And we won't be sharing people's contact details. So I know someone put it in their thing. So obviously just take a note if you want to contact someone else. We won't be sharing it between the attendees today. We will just send an email out to everyone, blank carbon copy with the details from the programme. I think that's it.
Great. Thank you all very much, and look forward to speaking with some of you, hearing from some of you, getting some applications in from some of you in the future. Thank you very much. Enjoy the rest of your day.